you didn't read it wrong. The first sign of pregnancy isn't nausea, vomiting, implantation bleeding, or even a missed period. And it's not breast tenderness either. It happens before all of that. Want to know what it is? And don't worry, many women think, but I didn't have implantation bleeding. If you're pregnant, you had implantation, and you may not have had bleeding. But implantation, which is the process of the embryo attaching to the uterine wall, is necessary for pregnancy. It can cause bleeding or not. 30% of women experience bleeding during implantation, while others don't have this symptom. But implantation comes after the real first symptom, which is cramps. It's a symptom that can be confused with a sign of menstruation, but it's a bit different. And that's why it's so important to know your own body. When you start paying attention to your body, you'll be able to differentiate between menstrual cramps and early pregnancy cramps. Early pregnancy cramps are more focused on one side, the side where you ovulated, either to the right or to the left. And it's not the kind of cramps that linger, no, they're more like twinges. As you already know, it's the process of implantation, with the embryo entering the endometrium, that causes these cramps. Do all women feel this? Not all, but a vast majority of women do. They just often confuse it with menstrual cramps, which are different when they start. They cover more of the lower abdomen, while implantation cramps aren't like that. They can have an effect in other areas, but the main characteristic is that it feels like a little knife, like a needle poking the mother's uterus. After these cramps, about 3 days later, the production of HCG begins. This is the pregnancy hormone that triggers different symptoms from those of PMS. You might think it's because of PMS or pregnancy because your progesterone levels are still increasing. Progesterone causes all that sensitivity. So it could be one or the other, pregnancy or PMS. But when HCG starts to increase, you start experiencing more specific pregnancy symptoms. Of course, the best way to know if you're pregnant is by taking a pregnancy test, whether it's a pharmacy test or a blood test. But it's best to wait for your period to be late before taking any of these tests. If you take it earlier, you might get a negative result that's actually positive. Or you might get a positive result that we call a chemical pregnancy, and then you'll have your period and be disappointed. So wait for your period to be late before taking the test. Of course, this is different for women who are undergoing fertility treatment. When you do take the test, let us know if it's positive. We'll celebrate together, or if it's negative, we're here to support you. Because since this channel is for mothers, I truly believe that you want to get pregnant. Unfortunately, or fortunately, it's not easy. The chance of a fertile woman getting pregnant with a fertile partner is about 20% per cycle. It's a very small chance that can take a year to work out, even without any fertility problems. So if you're anxious during your first cycle, don't worry. Most women don't get pregnant in the first cycle, and 80% get pregnant within a year. After a year, it's time to see a doctor for better monitoring and to decide if you want to start treatment to help. If you usually have menstrual cramps regularly, try to pay close attention. Make notes in a diary, because when you get pregnant, you may notice the difference between PMS cramps and implantation twinges very early on. Share and subscribe. Leave your like. Thank you for watching.